this point, you will have already had an introduction to the facility and a workup done by one of our medical assistants. Over the next several minutes or hours, I would go over your case, examine you, and describe to you what the radiation therapy process is, along with the indications and options for that. The next thing I would do is show you around to get you accommodated with the facility. So what I'll do next is show you around. So if you'll follow me. Over here is where we keep some scrub pants. Radiation therapy uses x-rays. X-rays don't like metal. You may not realize it, but there's probably a lot of metal in your pants between buttons and zippers. So when you come in for your radiation therapy treatment and simulation, you'll either use a pair of these scrubs or you'll use a pair of your own sweatpants or something like that. The changing area is over here. Restrooms are here, changing rooms here. You'll probably have some street clothes, so what you'll do is go into one of these rooms. There should be automatic lights, get changed, and then put your street clothes in one of these lockers. Lock the locker, take the key with you, and of course if you need the restroom, it's right there. The first day, we do a CT simulation most likely. CT simulation is over here first. Walk down the hallway. So over here is our radiation treatment simulator. It's a CAT scan. Probably many of you have already had CT scans in the past. This one's just a little bit different. First, we start by constructing an immobilization device. Most times we'll use some kind of vacuum lock bag. If you were able to feel this through the camera, you could tell that this is a very soft substance, basically like a big bean bag. What we do is we put that bean bag and index that very carefully to this flat tabletop surface here, using this or another device. The next thing we do is when you lay down on that, we'll attach that to basically a vacuum tube. We'll then suck the air out of the bean bag, which will then create a seal around you. For example, here, you might be able to tell this is a much more firm form than what we had started with. The person's buttocks might be here, their feet would fit in here, and believe me, it's really hard to move from side to side, which is what we're trying to prevent. During the course of the simulation and your subsequent radiation treatments, we want to make sure that you don't move around, and this immobilization device is very helpful with that. The next thing that we do is we'll move you up into position and align you with a laser system. These lasers we use to make you straight. We use these lasers to guide the placement of probably 3 little tattoo dots, and when I say dots, I mean they're very small and you don't get to have anything real fancy. These dots will go most likely on the sides, and then one in the middle, and that's going to help us to keep you from being rotated during the course of this, and then during the radiation treatments. The next thing we do is we then send you through this big donut. This will then bread loaf you, creating a 3-dimensional map inside of you with all of your inside organs, target volumes for the cancer treatments, things like this, and then work with a dosimetrist and a physicist to make you a perfect radiation plan. The process usually takes anywhere from a couple days to a couple weeks. Before you leave, you'll meet with one of our therapists who will set you up for the radiation treatments. They'll be anywhere from usually 5 to 10 all the way up to 45 treatment days, usually Monday through Friday. Each treatment itself will take about 10 to 15 minutes. We'll take a look at that treatment machine in just a second. If you come over here, the radiation treatment machine is a linear accelerator. Here we can see one of our therapists, Eugene Gray, administering a radiation treatment. If you walk over here just a little bit without sacrificing any of a person's personal information, what you'll notice is that he is watching the administration of the radiation treatment. Right in front of him are 2 closed-circuit television cameras. You're being monitored the whole time. There's also a microphone system so that he can hear you. You're always being watched the entire time, so there's never any concern about any real safety issues. He'll start the radiation treatment procedure by doing a CAT scan actually on board the machine. That's something that differentiates us from other places. this cone beam CT scan allows us to do incredible things. We're actually able to see the inside of you in real time. That allows us to give image-guided radiation therapy with an amazing degree of accuracy, and also allows us to be able to change the radiation treatment procedures if we need to, depending on what happens inside of you. After that image is taken, the next thing we'll do is that one of the therapists will move you into position. The machine will slide ever so slightly. The therapist might have to go in to manually move you into that perfect treatment procedure, the perfect treatment area that's actually going to be the same as when we did the CT scan. Next, radiation treatment begins, and that's exactly what you see Eugene doing. Treatment area. If you follow me, we already saw where the therapists actually run the machine. On the inside, where you'll be treated is through this door. If you look around the room, what you'll notice is that there's several vac bags. If you remember, we created one for you, or we will create one for you during the simulation process. We then use that same bag in order to position you accurately and precisely each day during the radiation treatment. Your bag will sit right on this table, which can go up and down. What I would then have you do is locate yourself, or you would be located by the therapist within that back bag. This whole thing will move up and in. You'll be positioned here and lined up with the laser system using those tattoos we used for you. Once you're in that roughed-in treatment position, the next thing we do is do a cone beam CT scan. This arm and this arm will then come out and rotate around you. That allows us to create a cone beam CT scan like we were talking about earlier. That cone beam CT will be used to line you up in real time. It will show you exactly the position of your organs so that we can treat you very, very precisely while creating a very safe environment within you. Once you're in that position, there might be some shifts on this treatment couch. This treatment head will then proceed to move around you, basically like a circle, in order to give you the radiation treatment. It might be an intensity modulation treatment, it might be a stereotactic treatment, it might be a 3D conformal treatment. We can get into the details of all of that at the time of your consult. Suffice it to say, we'll give you the most appropriate radiation. It should be done very efficiently. The whole treatment will actually only take somewhere between 3 to 8 minutes. Therefore, door to door, you should be here maybe only 10 to 15 minutes. Sit down on the treatment bag, then move into position, line you up, cone beam CT scan, accurately position you for your internal organs, and then the treatment proceeds. Return you back down to earth, then you're on your way. Goal, 10 to 15 minutes, and we're almost always able to do it.